Hi, I'm Dr. Jeffrey Marino from Bellissimo Plastic Surgery and Medi Spa, and tonight we're going to continue with our snippets for Breast Cancer Awareness Month. As we know, with the COVID distancing and really trying to stay away from each other and to prevent the spread of the virus, we're going to do my favorite month of October, our favorite Facebook Live. We're going to have to do it sort of broken up this year instead of getting all together. Hopefully we can do this next year where we get everybody back in the office and start talking one-on-one and as a group about breast cancer awareness, things that are available for families and patients, and to help support the Breast Cancer Awareness Month. So tonight I have a really special friend and guest on, Mindy Markovich. She is a breast cancer survivor, and not only that, is now she has turned around and is really mentoring women that are now finding out they have breast cancer and helping them get through their journey. So Mindy, welcome. As always,
Thank you.
I wish you could be here. I could give you a big hug. So maybe next year we'll get you back in the office here. So
It's okay to just have a date night with you, though. That's okay.
So tell us about your story, about the breast cancer, how you, just kind of take it from the beginning and go through so women can
Okay.
see how
March of 2007, I had my normal gynecological exam, had found a lump, probably December, thought, oh, it's cystic, it'll go away, blah, blah, blah. Asked my doctor about it. And funny, he said, oh, if it was cancer, you'd have been dead by now. But the next day I had a mammogram, just like that. So that's what I found out the following day.
Mm-hmm.
There was nothing on my films from the year before. It just was there. So I started to go through the regime of biopsies and testing and what have yous. I was told I only needed to have one breast removed because of the size of the tumor. Then my oncologist surgeon, I guess that's what they're called, said, well, we kind of see something funny on the right side. I go, just take them both. Just take them both. I talked to a good friend of mine who had mastectomies, 2 mastectomies, different times, different surgeries. And I said, Janie, what would you do? And she said, just have them both. And my type of personality, I would have been scared the rest of my life. Right. So I elected to have a double mastectomy.
How old were you at this time, Mindy?
I was 48. I just turned 48. So I had a double mastectomy in April. It went fine. Really, the mastectomy was probably the easiest surgery I had. Wow. A year later, same date, same doctor, I had a full hysterectomy because I had some pap smears that were not good, not cancerous, but not good. So they chose, because my cancer was like a stage 3A, that they didn't want me to have to worry about any other kinds of cancer. So I had the hysterectomy. That following September is when I met you.
Right.
And had a reconstruction with the lap flap from the latissimus muscles, and had the implants put in the front. And yeah, that was 12 years ago.
I know.
So yeah, isn't it though?
Right.
I'm 61. I just retired. And I'm feeling great.
Good. So let me ask you, because I'm seeing more and more of ladies opting to have both sides removed. Do you think being 48 kind of led into that? And so, it's hard to say, but what if you were 38 or 58, or, would that have changed your mind, do you think?
I don't think. I really don't. Looking back, there's a lot of things that are different. Like I can't lift things like I used to,
right,
because I don't have that latissimus muscles. I get a lot more backaches. There are some side effects from the surgery. There's no doubt. Right. But as extensive as it was, I think I'm doing pretty good.
Right.
No, I would have had both of them removed no matter what. Symmetrically, it was better
Hmm.
to do the reconstruction. You didn't have one sagging, one real, one not real, blah, blah, blah. And I think just my mental well-being of knowing that, oh, is that a lump? Is that not a lump?
Right.
It's not there.
Right. And
So,
that's what I'm seeing. And I think I told you that story back when I was still practicing in Los Angeles. It was a young lady about 35 who was diagnosed, and she was the first one to convince me that, doing bilateral mastectomies was a viable option. And just what you said, she said to me as well. I don't want to spend the rest of my life worrying
right,
about every little, pain, every little zinger that I feel, every
right.
lump, everything. I don't want to live that way. And, she was 35, she was single, had no children, and still decided to do that, which, I think is fine. And so most women that I'm seeing today that are doing bilateral mastectomies are saying the same thing. I just don't want to live that way thinking about it. Um, and I think that is a viable option, just as
Mm-hmm.
well as doing one side or a lumpectomy or not doing any reconstruction, or, I think it's really up to the woman and what she wants. And so,
Right.
you know,
It made me feel whole to have the reconstruction. I don't know that I could have gone without it, mentally myself.
right.
And it's a personal thing. Um, Most days I don't even think about it. There
Mhm.
are certain days I do. I'll see scars, or my back will hurt or something, and it'll bring back memories. But for the most part, I don't think about it at all.
Good.
I don't think I was ever sick.
Yeah. So let's talk about now what you're doing, because, I know that you have for many years since you've been through this. First of all, it's such an amazing thing to see women go through this and change from the time of you getting your diagnosis, your world's upside down, you're in a whirlwind, you don't know if you're going to come through this, you're scared to death. You've
Hmm.
come through all of this, everything you've been through, everything, all the revisions, everything that we've had to do. And now you're at a point where you're mentoring women going through it. So how did you turn that around? What happened?
Um, Not to bring religion into it, but when I was diagnosed, the first thing I thought of was God chose me.
Mm-hmm.
He chose me for this. He wasn't damning me for anything. He wasn't, punishing me. He chose me of because of me. And I knew that this was my calling in life, and it still is. Um, I started a breast cancer survivor group. I went through the whole American Cancer Society Reach to Recovery. I was a Reach to Recovery person. Um, I've even mentored husbands as to what she's going through, what she's feeling, what it looks like.
Mm-hmm.
I mean, my chest is not my personal being anymore. If somebody wants to see what reconstruction looks like, I show them. Our breast cancer group, we would meet at hostas and we'd go in the bathroom with the new, someone who was new, so they could see what you had done and what it looked like, because that was a real scary part. What was it going to look like?
Right.
I think I told you when we did the reconstruction, the scariest part was that marker,
Right.
and you were making marks on where we were cutting and where we were going. And I looked down, and I was sitting there by myself waiting to go into surgery. And that was just like bizarre to me. But, seeing the results, I mean, like I said, I've not had any trouble whatsoever since. Um, but yeah, I try to mentor anyone I can still.
Right. Well, I think that's
Um,
great because, as you've been through it, I mean, it's even with a support system, it can be a very lonely journey because
oh,
it is affecting you first and foremost. And so, we'll get into the husbands and the significant others in a few minutes here, because that's another part of this that's so key, that's sort of been kind of not really thought of very well. But going through this with a lot of women, there's days where, even with the best support system, it's happening to you, and you have to deal with it, the chemo, radiation,
right, right.
and then also really attacking that part of you that are coming to grips with the fact that this is attacking your femininity, your womanhood,
Oh yeah, right,
right to the core.
right. Yeah, I have no girly parts whatsoever, you
Yeah.
know, but I'm here. And if, I mean, I'm single, I'm 61. Do I date much? No. Do I want to? Not really. But there was other things in my life to keep me busy. My father just passed away in June. He was 94. I mean, I took care of him the whole time. My son's 26 and redoing a house, and his father passed away in December. So we've been through a lot this year.
Yeah,
Um, so that's where I'm supposed to be.
right.
And if somebody doesn't like me because I had breast cancer, I don't care.
Yeah.
Then you're not worth it.
Well, I think that's
To
the key
me.
thing is that, I think a lot of ladies get through this and in a kind of in a weird way, their self-esteem actually goes up.
Oh
And
yeah.
I think a lot of women, and what we try to encourage them is just exactly what you epitomize. I've been to hell and back, and
Hmm.
I deserve, more than this, and I'm not going to settle
Yep.
for somebody not accepting me for who I am. And
Exactly.
it's a great thing to
Exactly.
see in any patient because it's really a light that you bring. And so I think you help mentor those ladies. How many women do you have in your group now?
Um, well, and I shouldn't say this. I haven't been to group for a while, only because of my personal issues going on.
Mhm.
But there's about 6 or 7 that go regularly.
Right.
I'm in touch with them when needed. We get a few new ones. Um, talk on the phone with people who know me, um, just in normal everyday life,
Hmm.
and find that their sister-in-law just got diagnosed, or their mother-in-law or something. Can they call you? Sure. And I've talked to many people I've never met,
Right.
to just kind of say, you know what, you can do this. It's okay.
Right. How about with the COVID, the lockdowns, the social distancing?
Yeah, we did
How
not
have
get
you come
together.
up
Yeah,
with?
we did not get together. We did not get together at all during that. Partially because a lot of them were going through their chemo,
Hmm.
and um, wouldn't go out and
Sure.
shouldn't go out. Their immune system was down. So, but there was a lot of back and forth on Facebook and private messaging and things like that. That everyone was still in contact, and um, yeah. So that was good. There's still a support system there.
Good. And I think that's important too, because again, what we were talking about, especially those ladies going through the treatments
Yes.
and they can feel lonelier than ever, that's about the time when you really need the support group.
Right.
And now it really isn't available for lots of reasons. And like you said, you sure as don't want to expose any of them.
Right.
So we were doing the same thing here. So I was seeing the patients and, making sure everybody was covered and masked and really, trying to do it that way. Um, but it's interesting is that COVID doesn't shut down cancer for any reason at all.
No, it does not. It
And,
does not.
and the support that you need. So, on the other side of that, when you talk about the male part of this, I think that's sort of, from a male perspective, it can be something that, I reach out to all of the men, that are with these
Hmm.
ladies and tell them, it's going to be hard for you too. It's hard to watch somebody you love and you're supposed to be here to protect when you really can't do much anymore.
Right. Right.
You rely on the nurses and the doctors to do that. You have to be the support at night and during the day, and somebody that you're trying to be supportive of, but you're not really getting much support either.
Right.
And I think that's the hard part. I think that's we also see some of these relationships breaking up over this in this
Hmm.
time frame because it can cause so much strain on a relationship.
Yes, it can.
Yeah, and I mean, and that's why my hats off always to people like you who really are there. You've been through it. You're there. You support all of these families, any woman that needs to, and like you said, the men as well. So,
Right.
um,
Well, my son's even finding himself supporting his friends whose mothers are now being diagnosed. Now he was only 13 at the time, but it was very devastating to him.
Yeah, I can imagine. I mean, especially at that time frame, watching your mother go through something like that.
Hmm.
When the guys that do ask you questions, what I mean, what's sort of the common theme that they
Um,
are concerned about?
the chemo, how sick is she going to be? What should I do? What can I do? People are asking, what can we do for you? I said, let them do anything they want. I
Hmm.
said, you don't need to go out and cut the grass. You need to be inside with her. Let your buddies come over and cut your grass for 6 months.
Hmm.
They want to do something. They want to help you. Let people do these things. And I said, and spend time with her.
Yeah.
I said, she's going to be miserable. She's going to be miserable. Don't fight with her. I had those days, 3 days after my treatments, where I just thought the world was coming to an end. And why am I doing this? Why am I putting this poison in my body? And I mean, I just wanted to die.
Right.
The next day I woke up and was fine.
Hmm.
But you have these days. And, just to let them know that, yeah, you're going to hit the lowest of low. And you just have to just listen, just be there to listen to her, help her. Um, yeah, that's all.
Yeah, I think that's so important to have somebody voice that because you
Hmm.
through it, you know what you were going through. And the patient I was telling you about in California, she was filming herself and she was
Oh,
going
wow.
by herself because she didn't have anybody. And so what she wanted to do was put out a film or a video that women and their spouses or significant others could access to show them what it was really like, because I think the
Hmm.
fear of the unknown, and I think that's the thing with anybody, but especially with men, is what can I do? I don't know what to do. How can
Right.
I help and not be a burden or get in the way? And so I think it's giving that advice is perfect.
Yes.
Because there's nothing you can really do, and for the most part, guys are not good nurturers. I mean, we're
Right.
just not good for that.
Yeah.
So, that's why I think the women with their support groups do really well.
Yeah.
And we had, we were talking about our clubhouse and what they're doing.
Hmm.
And, it's great because they can do a lot of things through Zoom and through the video challenge, chatting and
Yeah.
everything else. So I think that's right. It's the keeping people in contact, keeping people in touch with one another, no matter what, uh,
Right.
is helpful. It's always nice to give somebody a hug, but it also is nice, just as you've done. You're always available on the phone. You're always there, day and night. And I know you're like that because I've known you for 12 years now.
Yeah, a
And,
long
and
time.
yeah, and I think it's great. I mean, it's amazing. So you've really done a lot to help these ladies, and so I really try to get a lot of women involved with these support groups, and not only for themselves, but so that they understand the benefit of it, and then they turn around and do what you do, and now you're the beacon, you're the sort of that strength that they need to draw
Hmm.
from. Um, so I guess if we were, now we're going to get kind of finish it up here. What if you had any advice to any woman who, all of a sudden gets hit, their world is upside down? What advice would you give them?
Take it one day at a time. Don't worry about your reconstruction before you even have your surgery.
Right.
Um, that was my biggest thing. And I would get online and I'd be looking and, trying to figure out how I'm going to do this and how I'm going to do that. And really, it just like concentrate on the chemo or concentrate on the mastectomy or lumpectomy, or, a lot of people are having chemo first now.
Mhm.
My older sister was diagnosed a couple years ago and she had her chemo first and a lumpectomy. It was harder being the one watching than
Right.
it was being the patient. And I found that out. It's very hard to watch a loved one go through this, even though I understood what
Right.
she was going through, but I couldn't do anything.
Right.
And people have to understand, you can't do anything to change it. So, go with it. But yeah, I would say just take each step as it comes and don't rush anything. Just just listen to what is coming up next.
Yeah, I think Well, that's why I brought it up about the men because, obviously, we're talking more about women's breast cancer. It's much more prevalent than male breast cancer. So,
Right.
and so now, from not only going through it, but also being the support system, it's very difficult.
Yes, that part, it was so much harder.
Right.
Um, yeah, it was devastating to me knowing she was going to go through what I went through. I mean, I wouldn't wish that on anyone.
Right.
Um, but knowing that I went through it and I got through it, I knew she could too. And that was my support to her.
Yeah. Well, I think
So,
I think it's hard knowing women, that have gone through it. And I think the hard part for a lot of women, especially women with families, and you had a 13-year-old, it's hard because I think it's a time when you really do need to be a little bit selfish,
mhm,
and concentrate on yourself because you've got to get through it.
right,
And so you need to get it. And it's very hard for women to do that because, especially those ladies with families, because you're always going to put the family first.
right.
And so I think sometimes women are overdoing it and they're exhausting
Yep,
themselves. And,
yep.
you
And that's
know,
why I say just, so many people reached out to me and said, what can I do? Oh, if I can do anything for you, let me know.
mhm,
And for people who are going through it, don't say that.
yeah,
Say, I'm going to come over and cut your grass. I'm going to come over and clean your house. I'm going to come over and, shave your dog. Whatever it is.
right,
But you need to tell these people what you're going to do for them, not
yeah.
have them ask you, because no one's going to ask. No woman's going to ask for help. Um,
Exactly. And no one's going to accept the help either. So that's
exactly.
ground right there. So, I agree with you 100%. So, but listen, Mindy, it's always great seeing you.
You
And
too.
we'll have this aired out in October. So it's great seeing you. I hope you
Perfect.
can get together soon. And
That'd be
thank
great.
you for doing this with us. And I hope and pray next year we are all back together.
Absolutely.
Uh,
Absolutely. Thanks so much.
all right. Have a good night.
All right.
Bye
You
bye.
too. Bye bye.